Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My phone number is 408 687 1899. Anytime when you are suffering from any disease at any age and you are tired of any treatment, please give me a call for your second opinion of your diagnosis and also of the treatment as well. I can guide you how the nature was curing this body before the medical existence of the medical science, and at that time what were the measures adopted by the nature. And nowadays many things we are doing against the nature's rule, and that is why to go fast it has become our principle. To do fast, it has become our principles. And that principle, many places, does not suit to the nature. Nature had its own program to repair this body. Our different tissues are repaired in a different time. But we are overpassing all these periods and try to recover the systems, the different tissues, different cells, according to our own mentality in a fast way. And that is why many things go wrong. Many things results in a bad prognosis. And ultimately, we again stuck up because we did not get the proper cure. We did not get the complete cure of the disease. And the disease comes on the system one after the other by changing symptoms. And when the symptoms of the patients are changed, doctors recognize this thing as a new disease. They do not correlate the previous disease is related to these symptoms. No, they do not. Because previously it was in some other organs and now it is in some other organs because of their effects, because of their efforts done by the medical science, which were not according to the nature's principle. And we are stuck up there because doctors are not ready to understand, doctors are not ready to take responsibilities of this thing, that this is because of that. Just for example, I have given this example many a times in my programs. Just for examples I can give, suppose if a person has rheumatoid arthritis and rheumatoid arthritis has been suppressed, I will say suppressed, not cured. But curing is the repair of the internal tissues in a normal way. But whatever we are doing suppression of the symptoms. We are suppressing the pain. We are suppressing the structures at them forcibly. And then we have noticed with the study of the philosophy of chronic diseases that it transmits or it radiates to some other organ. Sometimes it is radiating, sometimes it is migrating. Means sometimes that pain in the joints still remains there, and with the strongest medicine to subside these pains, patient has another problems, cardiac type of problems, palpitations and all those things. Various other symptoms are added to that one, whereas the doctor do not recognize, do not prove this thing, that this is the result of our wrong medications. This is the result of our suppressive medications, which were not going according to the nature's principle. They were going against the nature's principles. And in this way, ultimately, what happens? Sometimes the pain subsides from the local area where it started. It's the primary stage, primary place, you can say, in the systems, and ultimately it goes to the other organs. It's not only the heart, I'm saying. There are various other diseases, just like the skin disease. If it is suppressed, it goes to the lungs. And most of the times we have noticed with the study of the chronic diseases that if a skin disease has been suppressed, and ultimately regularly it is suppressed, and we have noticed that the same person is suffering from the respiratory type of problems, maybe asthma, maybe bronchitis, maybe allergy type of things which are related to the respirations, but the doctors do not recognize this thing, that these are the causes of our medications given or suppressed. Basically, I will say it is suppressed. It's suppressed only from the skin, and ultimately it has gone out. As I have explained many a times, that inside the body there are nine systems working, and nine systems, when they are working normally, a normal life is produced. But when any of the symptoms, or most of the symptoms, or a number of symptoms, they systems, they are not working normally, at that conditions the life is not normal. It will indicate himself by some symptoms which are known as disease. And when this disease is suppressed by forcible medications, tropical ointments, and all that, then it goes back to the source. Just for example, I can give you that all the nine systems are producing garbage, and all the nine systems having their own system to remove the garbage from the cells, and it is released, or it from outside the body. This is known as uh, secretion and the excretion. The garbage which is released from any of the organs inside the body, from any of the systems, is termed as secretions and excretions. When we say excretion, it means it has gone out of the body and it is not again used again. Whereas the secretions are those type of garbage, a special type of garbage is released from some of the organs inside the body, and those garbages are used by the other organs for their purpose. That is of useful. Just like from the homes and anywhere, you remove some of the things which you do not need at that time, or because of some space or anything else, even some new things you put it outside, and in your backyard and front yard, and then ultimately some of the companies they come over, or some of the peoples they come across that one, if they need those things, because it's free, and they pick it up. In this way, many of the garbages are secretions, and these are produced inside the organs of the body, and they are used by the other organs inside the body. Just like cholesterol, bile. Bile is produced by the liver and is used by the intestine for digestion. Endocrine system. All the endocrine system, glands of the endocrine system, produces their garbage in the shape of hormones, and those hormones are necessary to activate the other systems for the functioning. It means these are known as secretions, not excretions. But your stool, your urine, your sweating, your breathing, all these are the sources of releasing the garbage from the body, and this is the releasing of garbage by these means is known as excretions. And in this way, if most of the garbage has not been released, actually the purpose, we are taking water, we are taking food from the mouth, and it is mostly released by the stool. but some of it is not properly released by the stool, and it goes back to the bloodstream and mixed up into that one. But this is still a garbage. And that garbage ultimately circulates throughout the system. Ultimately, it reaches to the skin as well. And skin is the largest organ which secretes excretions. Excretions which is already concentrated in the blood. And when blood goes to the skin in circulations, skin take it up all this garbage and try to release it by the sweat. And if that garbage is irritating type of things, acidic type of things, chemical type of things, it causes irritations over there. Sometimes a garbage is a special type kind of this one, that it is not coming out like a perspiration, like a sweating, but the skin swells up. We say urticaria. Or sometimes this garbage is type of acidic type and or has chemical type of things which causes irritation in the local areas, and we scratch. And ultimately, from the scratching, first of all, it's a dry up, and after that, it becomes ulcerated and ulceration, and we say it's oozing eczema. Different names are given by the doctors by the different type of expressions of this sweat or of this garbage which is being released by the skin. And when this kind of comes, and we have given different names to that one. Basically, basically, whatever is coming out from the skin is known as garbage. It's a garbage. And that garbage is the type of excretions. It's not being used again. So, in this way, skin is the largest organ of the body for excretion. There is various other purpose functions of the skin, but I'm talking about this garbage. Then ultimately, what we do when there is a skin irritation, when there is a urticarias, when there is a eruptions, when there is oozing eczema, whatever it is, erysipelatous, there are different kinds we have divided into to this garbage which is produced in the local area of the skin and even throughout the systems. Many of the symptoms, when it's circulating into the blood and in the skin and on various places, this garbage is coming out with the sweating, and it produces this kind of conditions which is named by different names: urticaria, erysipelatous, psoriasis, and many other names we give to that garbage, what type of reaction it is causing on the skin. And I'm talking about the chest, and I want to bring it back to you to the topic of the chest, that if you suppress that sweat, in spite of initiating, in spite of helping that this sweating should come up and clean the systems, whatever the maximum garbage has come up through the blood into the skin and it has been cleaned up, in spite of helping it to bring it more and clean it up so that the residual garbage from the body has been released, plus the organ which was producing the excess of the garbage should be treated, and it is not now producing the more garbage. What we do, the medical science nowadays in a trend to suppress that kind of sweating, suppress that kind of eczemas and all that by topical ointments or even the strongest medications which can suppress forcibly. And ultimately, it has been noticed by the philosophy of chronic diseases. By studying various thousands of cases in this way, it has studied that ultimately, this suppression of the disease goes to the same organ from where it was coming up, from where it was produced. And in this way, various external impression of the disease, or you can say the various external impressions of the garbage which is released by the skin, we are in the habit of suppressing that one. We are suppressing that one by the topical ointments and all that, and ultimately it goes to their source. And we have studied that there are various type of things which we suppress them forcibly, without knowing what the process of the nature, without knowing that what the nature wants to do. Ultimately that goes to its source, and where it goes to, we have studied that one. Just like I was talking about the pain joints. And if a person is being, because the reasons behind the pain joint may be different, but ultimately, just like arthritis, rheumatoid, and all these things, we are considering about the joints. And ultimately, when that is suppressed by the strongest medications, that no, we do not need this type of this type of pains, and ultimately to give strongest medications, that pain is subsided by the suppressed from the joints, and ultimately we have noticed it goes to the heart. Same way I was talking about the skin, that when you relieve, when you suppress that skin eruptions, that skin sweating, that skin erysipelatous, whatever it is, in spite of understanding, by taking the complete history of the person, that from where this garbage is coming up to the skin, which is producing this type of erysipelatous or psoriasis or whatever it is, ultimately it will go to the same source. And it has been noticed that the skin eczema mostly has its route towards the lungs. Most of the kids, maybe whatever may be the reason, maybe vaccination, maybe something else, and they are having, doctor say he's having allergy, respiratory allergies, and also they develop skin problems because they give them inhalers and all those things just to dilate the bronchus, so that there should be respiration facility, and the respirations are produced normally. But ultimately, this is not the treatment. This is not the proper what the system is demanding. System is demanding to improve the immunity so that he can face the environment, and he can be healthy even with that environments. But we are in the habit of, in the medical science now, we are in the habit of suppressing those things just to get immediate relief. Just to get immediate relief, ultimately, even the patient witness this thing. Even the patient like this thing, that okay, oh yeah, yeah, well, since doctor gave me this nebulizer, since the doctor gave me this inhaler, I'm feeling better, and they're happy with the doctors. But actually, they do not know what's going on, because we are closing our eyes from to treat the actually cause of that thing. Why repeatedly he needs the nebulizers? Why repeatedly he needs these type of bronchodilators, inhalers, and all that? And we forget that one. We stop the treatment, and that's, oh, this is the final, okay, take these nebulizers and go to home, and whenever you need that one, you can take inhalers one time, two time, or three times, and ultimately, but this is not the treatment. So ultimately it is suppression. It is a suppression of the cry of the vital force, that what it needs, by the symptoms of respirations, or how this vital force is weakened by the environments and all that, and and the respiratory system has involved more, and now we are just giving help to the respirations, but not going to the deep rooted causes of that one, so that it be cured permanently, and there should not be such type kind of symptoms. Weak immunity, sometimes the doctor says, okay, after 10, 11 years, the immunity will develop up, and ultimately he will be all right. Does not mean that he should suffer for 10, 11 years or 12 years with these conditions. We should have means, we should have developed our medical science to the extent that, yes, in spite of waiting for 10, 12 years, when he becomes in the he's entering into the adolescence age, and his immunity is increased, he should be cured before that. But At that time, what's being done, that is to suppression. That is to temporarily dilate the bronchus, and ultimately continuously doing this thing results in that extra garbage is produced. That extra garbage is circulating through the blood circulations. Extra garbage that is circulating into the blood from that organ goes to the skin, and ultimately that skin does its own duty to exclude that one, to secrete that one garbage, and ultimately, because of the nature of that garbage, irritating, acidic, or all that one, and ultimately that causes skin erosions, skin ulcerations, and then we give different name to that one, and we do not recognize that they have the relations what we have done in the lungs. They have relations of our wrong treatment, or if we do not want to say the wrong treatment, you can say that suppression treatment. Temporarily you have relieved the patient, good thing, but ultimately, temporarily and regularly, uh, depending upon that type of treatment is not the purpose of the medical science. The purpose of the medical science is to bring up the immunity at a level that in whatever environment a person is living, that in whatever type of food he is eating, that whatever his habits are, anything if it's wrong should be corrected, and ultimately the immunity should be developed to the extent that in this environment by this food he should be okay. He should not have that kind of allergy or respiratory problems, and we do not need to take the inhalations, that inhalers, and that will not cause ultimately double. First of all, the vital force is suffering from that type of allergy, plus vital forces is being suppressed forcibly, that kind of respiratory problems, and in that way the vital force has to suffer double, and that circulates, that garbage is double garbage. One of the garbage is produced by that organ, the other one, the medicine which you are giving, ultimately at a certain period, after the certain time, it becomes garbage itself, and then it is released. Just like you might have heard from the doctor saying, okay, after every 6 hours or after 8 hours you have to take the medicine. Why they say like that one? They say they know that this medicine will remain inside the circulation of the blood, and ultimately within this period, the effect of this medication or the concentration of this medicine will be released from the body, and again you need to take the second dose. That is why they are asking, take it 2 or 3 times, or take it 8 hourly, take it 4 hours, in whatever way, whatever the doses are. It means they know that this medicine will be excluded from the body, excreted from the body in this much time. And after that, you need to take the same things. So, in this way, what we are doing, the same thing, but vital force has to suffer from two kind of pressures. One, ultimately the damaged organs, ultimately the environmental or whatever type the factors which are causing the problem to the organs, plus your medications, because medication is not relieving the causes. Medicine is just relieving the temporarily symptom to facilitate this thing. So in this way, we have studied various diseases which are suppressed from their source, and they are producing garbage. When they are suppressed means it's not cured. Just like you have any conquers inside your feet, and that you, until you remove that, the painkillers or anything will not work. That's also adding a garbage. That's also adding an overwork to the vitality, until that conquer will be removed from the feet. In this way, repeatedly you are doing all these things, repeatedly you are producing an extra garbage, and also there is a garbage of the sick organs. So all these garbage are circulating inside the inside the blood, just like why addiction peoples when they go for the drug test, what they say, what does it mean? It means that if ever a person is addicted, that drug substances will be circulating in his blood, and that means the garbage. The garbage of that substance will be circulating still into the blood. And if we test the blood, if you test the breathing, you can find it out. And I'm talking about that one. The most of the garbage are released by the stool, and then after that it starts circulating into the residual garbage starts circulating inside the blood circulations, and ultimately blood reaches to the kidney, and kidney filter it out, and it is released through the urine. But still some of the garbage remains, which again circulating and goes to the skin, and skin releases it by means of sweatings. Most of the garbages are little more harder, little more harder, which are not passing out from the pores of the skin. And under those conditions, nature has provided a certain type of machinery that is known as apocrine glands. And those apocrine glands cut off that stronger garbage, the hard garbage, into soft things, into dissolvable things, which is dissolved into the water content of the blood, and ultimately it is relieved by sweating. And in spite of suppressing that thing, the basic of the cure is that we should find out from which body organ this garbage is coming, and we should try to correct that one, that source. And until and unless you correct that source, you will not be able to cure this kind of eczemas and all that. Tropical ointments with you, with the treatment with the tropical ointments, you will not succeed. You will put stronger and stronger medications, and ultimately at a length, at a distance, that medication will exhaust. At a length, that medicine will be released, or its garbage will be released from the blood circulation, and ultimately the same symptom will come up again. Yes, it is possible that from some space it was, you have treated it with the strong, just like the steroids and all that, and it is relieved from one place, maybe, and next time it may appear to the other places. But you will not take the responsibility that it is the same thing. Though, first of all, it was in the elbow, it was in the cubital fossa, it was in the back of the knee, popliteal fossa, or whatever, but now it is in the back of the ears, it is in the chest, it is in the back. We do not recognize it the same disease. No, we think it's a different thing. It's a different thing, and treat it differently. So this is what I want to convey you, that most of the things in the chest area, when any of the organs is not feeling good, is not adjusting himself for the normal functions, because of the environment, because of the food materials, because of the habits of the persons. All these things are adding up for our diseases. And whatever they have changed inside the system and in whatever the systems, that produces more symptoms. It's not only that only one organ is affected, yes, but most of the symptoms are only in one system. Otherwise, the other systems may have little or some of the effect of that things which is causing the problem in one organ. And ultimately, if we collectively collect all the symptoms from all these systems, all the organs, then we can find out the complete picture of the disease, that this garbage which was produced by the environmental changes, which was produced by the food materials, which was produced by whatever reasons at that time, we know about that. Then, after that, we will guide to the patients that this is the reason, causes, you can say. This is the causes of your disease, and it will be relieved if you change your behavior, if you change your diet, if you change your environment, whatever it is possible, and ultimately he will be cured. So, in this way, most of the things we see symptoms in one organ does not means that that only organ is affected, which is producing the symptoms. There are various other systems and organs which are also feeling the pain of that disease, but that is not that much important, that is not that much painful as one organ is indicating. Just like we are talking about the chest, and we know about the lungs, we know about the heart, we know about the mediastinum and the organs passing through the mediastinum. And when any of the symptoms in these important organs is diagnosed as a disease, and we try to suppress it in spite of understanding that what may be the reasons behind that, what is causing the real cause. Basically, one thing more I would like to describe here. Uh, Normally, now the trend of the medical science is that the cause of the disease are the material, whereas the actual cause of the disease is not material. Cause of the disease or the material causes of the diseases are always provoking, always exciting, or maintaining the condition of the disease, but they are not the actual cause of the disease. Suppose if the earth is not suitable, you will not grow any plant over there. If the earth is suitable for particular type of seeds, they will grow over there. Not all the seeds are growing in all the soils. Why? Because they are not having their suitable environment over there, suitable feeding over there. The same way, if any disease is erupting inside the system, it indicates that the soil was prepared for him. That's known as immunity. In other words, we can say it immunity. So, if our immunity is strong, means it is not allowing any outwardly bacteria, viruses, whatever it is, to act on this body and to command this body or to produce the symptoms. In this way, we are, as a homeopathic doctor, we are of the understanding that causes of the disease, as termed by the modern medical science, that is known as allopathic side, they consider the causes of the diseases are bacteria, viruses, parasites, fungus, all these things, visible things. And then they say, oh, we see this one. Just first of all, you can say the fungus. Your open eye, you can see that one on the joints, on the fingers, on the skin. Somewhere there is a fungus. On the nails, there are different sites where this fungus can appear. And ultimately, you can say, oh, this is the cause of that one. And ultimately, some of the symptoms will result which are not directly related to the skin. They may be related to the other systems, but they are the secondary effect of that fungus. And in this way, after the fungus, we come across the parasites. Parasites are also a visible cause, as determined by the allopathic side. Parasites are the visible cause of the diseases according to them. And secondly, after that, there are bacteria which we cannot see in open eyes. Fungus, we can see in open eyes. Parasites, we can see by open eyes. But bacteria, we cannot see by open eyes, but we use the microscope. Multiply, enlargement of the bacteria, and ultimately we see and recognize this one. This is this type of bacteria, this is this type of bacteria. Now we know the pictures. There is a malarial parasite, there will be ring type. If this is a tubercular bacillus, there will be rod type. In whatever way we have picture in our mind that we can recognize that this is the bacteria. But after the bacteria, there is a virus. So this is the trend of allopathic style of diagnosing the causes of the disease, verifying the causes of the disease, that fungus, protozoas, parasites, bacteria, and viruses. But what homeopathic philosophy says, no, if the soil is not suitable, none of the things will grow over there. None of the things will grow. If you are cleaning your body every day, normally washing everything, fungus will not grow. But there are reasons behind fungus grow. Internally damages, internally deficiency of the diet, there are many other reasons. So if everything is covered, fungus will not grow. Same with the bacteria. So means everybody is not suffering from tuberculosis, everybody is not suffering from pneumonia, everybody is not suffering from different kind of bacteria. Soil is prepared for the growth of a different kind of bacteria, and then they suffer from that kind of bacteria. They accept the effects of that kind of bacteria and suffer from a particular type of disease. We diagnose and we give a name to that. And the same way I have told you about the viruses. Viruses are again tiny substances which we can see now with magnifying glasses more than the microscopes. And moreover, they are the hidden enemies that they live inside the bacteria. Inside the body, if there is no bacteria, they have this periods of incubation periods. And the incubation period of the viruses is about 4 days. And if any bacteria, suppose if we are infected, we are in contact with the infected person of the virus, he is having any problems. But within 4 days, if he founds any bacteria inside our body, then the infected persons or person which came in contact with the person who is suffering from the viral disease may show the symptoms. But if he is not having any type of bacteria, means otherwise healthy, means the soil of his body is not prepared to grow viruses. Soil is bacteria. So if there is no any type of bacteria, the viruses will not grow, and ultimately after 4 days of incubation period, when you came in contact with the sick persons of the viruses disease, you will be okay, no problem. But if if your soil is prepared, if you have any type of bacteria inside body, and these viruses make home or make use of those bacteria as a home, and then they start multiplying, growing, and producing their effects. And ultimately, their lifespan is 21 days. And ultimately, within 21 days, they will go off automatically. But the problem is, if within this period of 21 days they are complicated by some other diseases, some other causes, it may be dangerous. It may be virulent effects. The person may die, just like you might have seen about the COVID-19. In the initial stage, thousands and thousands of people died. Because nowadays we are in the habit of taking vaccination of most of the diseases to protect them in life. So means many types of bacteria, many type of all these things are still existing inside our body, and if anything type viruses type comes over there, they are easily finding any house for them, and then ultimately they grow over there in the bacteria, and then they become virulent and produce the symptoms. So in this way, we are having a different criteria. We are having a different trend about the production of the diseases, about the production of the diseases. Just like all these things which allow any other source of disease to enter into the body and act, that is known as exciting factor. Excites, just like you are having butter, curd, all you are having pickles, all that, and after that you suffer from sore throat, cough, and all that one. And this is known as that this thing, pickles or curds or butters, all this, these are the exciting cause. Another example I can give you, that everybody knows about, that the water is boiled at 100 degrees centigrades. But if the temperature is 98 degree, you will not say water is boiling. But ultimate, with the excitement of anything, temperature rises. Temperature rises more, 2 degree more. It will boil, and you will say boiling. And you will say that causes which has increased to 2 degree of temperature is responsible for producing the disease. It's not. Previously, a ground was prepared over there. Previously, a soil was prepared for the production of heat, production of any bacteria, production of anything, and it is growing over there and producing the symptoms. So, it means your body was susceptible previously. Susceptible previously means it was, the other example, it was having temperature of 97, 98 degrees, and some of the exciting cause came, and ultimately it is boiling. It's not only the reasons that exciting cause was is producing the disease, and you can say, okay, don't take curd, okay, don't eat pickles and all that, you will be okay. But all these substances which are in the universe, they are for our use. Yes, you can take precautions to not to fall to sick, but ultimately this is not the rule. The rule is that you have to, as a treatment, you have to maintain this body in a normal standard, in a normal standard, so that by simple causes, by simple excitements of this kind, he should not produce any symptoms. He should not suffer from this kind of temperature. Okay, if simple he is taking pickles, or if simple he is taking curd, and he suffer from sore throat, he suffer from fever and all that, means the soil was already prepared over there, means the susceptibility was always there. That susceptibility was always accepting this thing. So in this way, we have to take care of that one. And after that, there is another condition. There is another condition which can produce or not produce, but which can maintain the condition of the disease. And sometimes what happens, that's more serious condition, that's more painful condition, because sometimes we do not understand that in a normal routine, many things we are doing daily. In a normal routine, many things we are eating every day in a routine. In a normal routine, we are living in an environment. In AC, you are working, or in whatever environment you are working regularly, and since many years you are working in that environments, but ultimately somehow your vitality has become weakened. by somehow or other reasons that we have to find it out. And ultimately, now you are producing sickness, you are showing sickness symptoms, but you will not blame to that one. Another easy example I can give you: you are living away from the family, and you are not cooking your food at home and in a normal acceptable spices and all that, but you are eating your food regularly from outside, from the restaurants. And ultimately, you are taking it regularly, you do not feel, you feel good, oh, very spicy, very good food, and this and that, ultimately. And after a length, you suffer from some of the problems. And those problems may be, it's not necessary that it is indigestion or all that one. It may be indigestion, but indigestion may be associated with a headache, with a fever, with many other things. And ultimately you will not blame to that thing, because you said, oh, since many years I'm going to the same restaurant, and I'm eating food from that one, and nothing had happened. But this is known as maintaining cause. And to understand maintaining cause is very difficult, because you do not blame that one. Just like a simple example I can give you: your friend may be the strongest enemy. Your friend may be a type of enemy which can give you more harm, but you will not blame him. You will not blame him that he will be responsible for that one. The same thing, you will not believe that the spicy food I'm taking since many years is causing now problem, because the ultimately the vitality, as long as vitality was stronger, was accepting that kind of spices and that kind of things, it was okay. But now over time the vitality is unable to accept those kind of things, and then it is showing sickness. Ultimately, you are working in an environment where there was heavy temperature is down, AC is working, this and that. But you know, oh, since many years I am working in the same office, and since many years, and this AC was on, and everything is working in this way, in this environment. No, you will not doubt it. You will not doubt it, and that is why you will not remove it. That is why the maintaining causes, they are maintaining the status quo of your disease. Body has become sick because of the environment. Body has become sick because of the food. Body has become sick because of some habits. And ultimately, when you say all these things are continuously, I am adopting, and you do not blame that these may be the causes of your disease. In this way, it's very difficult to cure maintaining cause, because we do not understand, because we do not blame that one. We do not blame our friend. If ever there be anything harm caused to us, we do not ever blame our friend, because he is very close to us. He knows each and every habit of us. And if ever something happens to us, it may be that he is responsible. More harm. The enemy cannot do more harm as your friend can do harm to you. In this way, all these things were familiar to your body, and you cannot blame these things. And if you cannot blame these things, you cannot remove the thing. You cannot take precaution from that one, and you will not get well. So sometimes this kind of conditions, when you do not know what is causing us, and temporarily for every symptom you are taking some of the treatments, getting well, again suffering from that one, and again suffering from that one, and again taking the treatments continuously, go on for a longer period, and the vitality becomes weak. Your vitality is becoming weak, and as the time passes, you are suffering more and more from the same environment. You are suffering more and more even after taking precautions from all those things, because the vitality has become weak now. And even little exposure of food, that kind of food, spicy food, and little exposure to the environment or AC and all that will cause problems for you, and you will produce sickness. You will show signs of sickness. In this way, under these conditions, necessity is to find out all the causes. And I am giving one example for this one. Suppose if in one room you smell bad and you are unable to find it out, you are unable to find it out from where the bad smell is coming. What you do then? Then you take up all the stuff from that room out and ultimately clean the room. Then, one by one, you bring all the stuffs in and you can find it out from where the smell was coming. Question is solved. In this way, when this type of condition happens, that even with the better treatment, every time you take the treatment you get well, and after that you again suffer it. Every time you take the same type of treatment, again you suffer repeatedly. When this type of conditions are coming up, then what to do? Then you should change totally your habits of eating. You should change your behavior. You should change your environment where you are working regularly, and ultimately you will see, yes, you are getting well. It means whatever is the reason behind the disease is your food, is your habit, is your environment, whatever. It is only in between these three things. And then one by one, you add those things and you can find it out that this was the reasons behind my disease, and you can get well. But the get well, as I told you previously, it is not get well because the immunity has become weak. Now, the actually treatment for every disease, for every system, for every patient is to improve the immunity for every person. Nature is not enemy for any persons, and nature has given everything to every person. But if someone falls sick, it means it is because of his habits, because of his food, because of his tendencies. And then you have to find it out and improve that standard. Why it was? There are means that yes, you can improve your immunity, you can become stronger. And you might have seen that if you go to rain, there are 3 4 persons go to the rain, they wet in rain, and ultimately next day, one of them was having sneezing, little sneezing, tiredness, and the other one may have a fever, sick, in bed, and all that, is unable to go to the job. And some of them may be totally healthy, no problem. And ultimately, why this difference is because of the vitality, because of the immunity. And ultimately you have to, the main reason is the immunity, and you have to improve the immunity of the person. And if you come across this point and work on, for every treatment, for every sickness, for every person, if you work on the immunity boosters, ultimately you will find that you are curing your patients forever. Most of the things will come, because nowadays there are many more type of miasms, many type of reasons behind the diseases. And ultimately, even then, most of the persons who are coming to you for treatment, repeated treatment for the repeated type of sickness, will not come to you, will be cured for that one. Though there are various other reasons they may come to you, but things which are because of the immunity, and you have improved the immunity, and similar type of symptoms he will not come again. So in this way, many of these things are happening, and most of the symptoms, when there is an internal change inside the system, comes up outwardly. And we are nowadays passing through a phase that if in this system, in this body, anything happens, anything goes wrong, it indicates himself outwardly by the symptoms and indications, and we are identifying those type of symptoms, that if something happens in the chest, if something happens in the chest, what are the signs we can see outwardly. And in our last lectures, we have given you the most of the signs of this thing, that first of all, the pain. There will be pain, there will be pressures, there will be tightness in the chest. If something happens, any, whatever may be the organs, maybe lungs, maybe mediastinum, maybe the pleura, or the heart, or anything. And the first of all, pain, pressure, tightness, shortness of breath, sudden swelling anywhere, especially in the legs, ankles, feet, and all that, and unexpected and plain. You can see the fatigue. And there's no reason here. I was okay. But every day I go to the same work, I do the same work, and ultimately today I feel weakness. Even during the working hours, I need to sit. I want to sit down because I feel weak. I feel fatigue. In this way, these are sometimes it happens because of something is wrong inside the chest, maybe low oxygen, maybe palpitations, all these things. And why they are, we will go later on. Why these things, we will go later on. What's the actually cause? And after that, the rapid, irregular heartbeats, dizziness, nausea, all these things are the associated initial symptoms. These are the initial symptoms. If anything goes wrong with the chest organs, we can see that. After, there are some physical signs, just like I told you about the swelling, yellow patches, fatty disposition type of things, high cholesterol, and risk of coronary arteries disease. All these things are some other signs which we will elaborate later on, and we can find it out. We'll come across to the diagnosis that yes, they are having this kind of conditions, and some of the symptoms are at the fingers, and some of the symptoms are externally visible. We will discuss in our next program, because today our time is over. So we are at the chest organs. If anything happens in general in the chest area, then what are the external signs we can see outwardly, and which can indicate that something's wrong in the chest. This is Gurdeep Singh Sandhu, your homeopathy consultant. I'm here at 9701 Sarah and Court, Dublin, California, 94568. Phone number 408-687-1899. Email address homeomedicine, HOMEOMEDICINE @yahoo.com. Anytime, if you are suffering from any disease at any age, you can call me for your second opinion of your disease. And also, if you want to be treated with a homeopathic scientific approach to your health, yes, you can call 408-687-1899. I will see you tomorrow for the next. It will be, I think, in Punjabi or Hindi lecture tomorrow at the same time from 5 to 6 p.m. California Pacific time. Every day I'm here to deliver another lecture of the health, that is from 5 to 6 p.m. in California times. So you can join if ever you think these lectures are beneficial to you and you get some type of knowledge which is useful to you. Then you can convey this message to your nearest and the dearest that they can join Sabarang radio station.com. Sabarangstation.com is the app. You can download your Android phone, iPhones, and you can listen all the programs from morning till night. It starts at 6:30 in the morning with a Gurbani and Shabad, Bhajan, then filmy Geet, Sangeet and all that, and in between skits and all that. And after, you can say, 5 to 6, I appears in your meetings. And ultimately, these programs go on until night. And 24 hourly, you can listen wherever you are in the world. If you download the app anywhere, you can listen all the programs of Sabarang radio station. Or even if you want to listen these programs only, then you can join Facebook media and you can become friend with me and send request for that one. And whenever this program will start, and you can watch these programs. But if you are not available at that time, it's easy for you to see my this YouTube page book, and YouTube page will indicate all these things later on, even because they remains longer life on this one. And my all my downloads lectures, you can listen for each disease and every sickness whenever you need. And so if ever you need any type of help, anything you want to ask me regarding the health, you can call 408-687-1899. God bless you all. We'll see you tomorrow.